Well, I think it's incredibly inspiring to be in a room with a diverse group of medical professionals, from benchtop research, from rat research. I used to work with rats in some of the research I did prior to medical school, all the way to people like me who are clinicians, who are taking some of that information and seeing how we can incorporate it into our practice in terms of treating our athletes to be able to get them to recover from having had a mild traumatic brain injury. I'm a sports medicine physician, so most of the people that I see with mild traumatic brain injuries are the ones that have sports-related concussions. But taking that information and then collaborating, the ability and the opportunity to have this conference where there are time periods set aside where we can collaborate, sit, talk to other like-minded researchers and clinicians about concussions and how they impact the women and the girls that we treat has been really wonderful. My presentation today happened because of the research and the data that's been compiled by Dr. Dawn Comstock and her group with High School Rio, the injury surveillance system for high school athletes. And I took their data and compiled it and put it together so that the audience today would know that in the high school population, girls have 2 times the incidence, the rate of concussions as boys at high school. And we compared 4 sports. We compared basketball, soccer, baseball and softball, and the lacrosse. And the lacrosse comparison was especially good because of the fact that even though it's lacrosse for boys and girls, it's a different game in terms of the protective helmets and other things that the boys wear and the girls don't wear, and that the boys can contact with checking, and it's illegal for the girls' game. So looking at that data was really interesting to do that. It's important data because most of the data about high school kids have focused on high school football players, which are primarily boys. And so looking at some of the data that High School Rio has compiled shows us that looking at girls and boys sports, there definitely is a difference in terms of the rate of concussions, as well as return to play, recovery from symptoms, etc. Well, Chris Giza is a colleague of mine, a pediatric neurologist who did this groundbreaking research with David Havda, initially talking about the metabolic dysfunction. And his summary of Pink 1, which I was unable to attend because my son was in a championship soccer game, but his summary of what happened at Pink 1 was really great because he talked about all the presentations and some of that early research and abstracts about hormonal influence on girls and women and some of the other differences that we're finding. And I really enjoyed how he summarized Pink 1, and I'm really looking forward to seeing the publication that's going to come out with that. I liked several of the animal models in the animal studies, and I enjoyed looking at the posters because it really showed me what was happening from our brilliant researchers who are looking at these differences. I really liked the study on that looked at the those survivors of domestic violence, but looking at the head injuries and how it impacted their lives, their recovery, and psychologically how it impacted their, the psychological aspects of their recovery as well. And then looking at, I'm sorry, I can't focus on one because they all stimulated a lot of thought-provoking ideas on my part in terms of how I can continue to work with my patients. And some more questions that perhaps, I ask a lot of questions. My evaluations are very long and my notes are even longer. And now I think I need to add more when asking about past history. And as clinicians, we do ask whether or not any of our patients have been subject to domestic violence. And that's men and women, boys and girls. But really going back and taking that information and pulling that into a past medical history is very important because that's not currently a question I ask. I ask about previous head injuries. I ask about, for example, whether or not they've had a history of chronic headaches or migraines, learning disorders, etc. But I don't ask about domestic violence because people may not think that has anything to do with a head injury. But it may, and they just don't relate it because they're there for maybe a sports-related concussion and they're not thinking it has anything to do with something that happened in the past with a partner or from a guardian when they were younger. as a team physician, so I started practicing sports medicine in 1992. And I started at Ohio State University on faculty, and then I became the head team physician at UC Berkeley. And I was definitely noticing that there's a difference in terms of how the athletes, especially, and differences between the men and women, the male and female athletes, in terms of how they were reporting their concussion symptoms and how much longer it seemed that some athletes were taking to recover. And I will say that it's not so much female, male, it's that as well, but it's also somewhat of a personality findings as well. So as we talk about gender identification, we could talk about sex, anatomically, males and females, and we can also talk about gender identification and what is societally acceptable in terms of saying things. And so, but those things were all, and this was back in 1995 when I started at UC Berkeley, and I was a head team physician, so I was seeing everyone because we certainly didn't have the staff that we had at Ohio State. I began to try to make the subjective symptom reporting more objective, and I was talking with another clinician, Chris Giza, early on in my training. I didn't know what a neuropsychologist was. It wasn't part of my sports medicine team. And so I actually was starting to do some research. I had an undergraduate student, and we developed our own mini neuropsych evaluation that we had our student athletes do before they started their sport season. And they were color-coded. There were 3 different colors, A, B, and C, because we picked different words and everything, so that if they had a concussion, we thought they had a concussion, then we could retest them and see how they did. And then I discovered a group out at Henry Ford Hospital, Mark Lavelle and Mickey Collins, who were neuropsychologists who were starting to do this testing called IMPACT with the Pittsburgh Steelers. And it was crazy. And from there, we went to paper and pencil testing, a longer testing. I consulted with many neuropsychologists in the area, as well as Mickey Collins, to try to develop something for UC Berkeley. And around that time then, other computerized, easier to do baseline testing was being done, but that's just one component. That is just one component. And when you look at the symptoms that men and women have, sometimes they can be very different in terms of nausea, sensitivity to sound or light. You look at it, and is it, sex specific, male, female specific, or is it sports specific in terms of those types? But it's really more the way that the trauma happened. When Chris Giza talked about the fact that when you're looking at how we manage concussions, do you manage them differently if it's a girl who suffered a concussion versus a boy who suffered a concussion? And it's that provider bias. And it rang a big gong, because when I tore my ACL in 1985, and I saw the head team physician, orthopedic physician at my medical school, he said to me, well, you're a girl and you're in medical school, so you don't need your ACL. So just run and bike, do straight ahead activities, and don't do any cutting sports. Well, my whole life, I played basketball, I played volleyball, those are my team sports. That's an example of provider bias. And I feel that that's the same way that can happen with young men and women, boys and girls who have concussions, is that the provider may offer their bias in saying, well, you can switch to another sport. Versus they look at a guy and they say, wow, this identifies him as a lacrosse player, et cetera, and will be more aggressive in getting him back to return to play. Now, I believe that that's changing. In my almost 25 years of practicing sports medicine, there are more and more women that are now sports medicine physicians. There are more and more women who are in fields where they're going to be seeing sports-related concussions. And I do think that's changing. But I do agree that it's not only provider bias in terms of looking at a patient as a male or female, but it's also provider bias from their own experiences, their own anecdotes with anything. And they can bring that subconsciously forward in terms of how they're going to decide return to play guidance.